let's picture the scene. So you've got a dog, and this happens all too often. You've got a dog or you've got a cat, and you've decided to research their condition, and you've chosen a specific, you've been on a blog, you've been on a forum, you've asked some advice, and you've kind of done a lot of research, and you've come to the conclusion that you want to do a certain thing. You want to give your pet a certain thing that is going to help treat whatever it is that they're suffering from. Now, that could be itchy skin. It could be the fact that they're a little bit stiff and sore in the morning, because they're arthritic, which is really common in our pets. It could be you just want to, treat the fact that they're drinking a little bit more, and maybe if I give this, that's going to stop them. What happens next is that you think things get better, really they're not. And then it comes to a time where things are getting so worse you can't ignore it anymore, and you take them to the vet clinic. Your vet then examines your dog or your cat, and they give you some devastating news that your pet has been in pain for a long period of time, and actually what you've been using hasn't made any difference at all, or they've been so sick and they've now become so sick that unfortunately there isn't very much that we can do to help them, that your vet can do to help them. They can manage and they can palliative treat, but there's not anything they're able to do to give a really long-term positive outlook. Now, that news is not what we want to be hearing at all, but unfortunately that is exactly what can happen if we make the wrong decisions. And that's not necessarily anything that's not pointing any fingers, it's not making any blame. It's all too easy to make wrong decisions. We've got so much information at our fingertips. It's really difficult to know whether that information is good, whether it's valuable, or whether actually it's something that you should maybe take with a heavy grain of salt. And so today I want to talk about kind of 5 main topics in this. So we've got caregiver placebo. So that's the placebo effect in pets, which you might think is an impossible thing to happen, but actually is a very real thing. We've got a phenomenon called regression to the mean, which I'll discuss in kind of more detail because it sounds a bit complicated, but actually it's really simple. And we've got cherry picking data, which really is when we're trying to prove ourselves right. We've got the Dunning-Kruger effect, which is massive if you're looking at different forums, even YouTube channels, anywhere that you're getting information online, blogs. The Dunning-Kruger effect is something to really take into account, and actually it's something that will happen in real life as well. You're all going to know somebody who knows everything about everything, and well, they're suffering from the Dunning-Kruger effect. And then finally, I want to kind of briefly touch on anecdotes versus other forms of evidence, and where they, how they play a role and how much weight you should put on them when it comes to making the best decisions for your pet. So let's start off with the placebo effect. So you'll probably know the placebo effect is when we believe something is working, we're giving ourselves a medication, and we believe it's making a difference, when in actual fact it's not making any difference at all, or it doesn't have any biological effect. The placebo effect in people can actually make us better in certain conditions and with certain diseases, because the power of the mind and the power of positive thinking, absolutely does make a difference. But clearly, if we're giving an intervention, if you're giving your dog or your cat a tablet, they don't have that thought process that says, well, this is supposed to make me feel more comfortable, if you like. And I'll use arthritis as an example kind of throughout today, because it's such a common thing that we see. It's massively common in both dogs and cats, and there's a lot of interventions that we can give that will fit into all of these categories. Excuse me. So, a dog can't think, or a cat can't think, well, I'm getting this supplement, so I'm going to, and that's supposed to make me feel more comfortable, and then have the placebo effect and feel more comfortable as a result. But we, as their caregiver, as their owner, absolutely can suffer from the placebo effect in their place. So this is called caregiver placebo, or another word for it is placebo by proxy, where we invest so much in treating our pet to the best of our ability and wanting them to feel better and wanting them to recover from whatever it is that they're suffering from, that we look for any little sign that says they might be improving, even if those signs really aren't there. A really classic kind of great example of this is with arthritic dogs. So there's been studies that show that, and vets are subject to this just as much as you as your pet's owner, because we want our patients to get better, we want our interventions and our recommendations to work, and so we're just as guilty of looking for improvement when perhaps it isn't there. But there's been, really good studies that shown when a dog was given a painkiller and when they were given a placebo, the owner and the vet felt that there was the same level of improvement, even when it was proven that there was actually no improvement in lameness for the dogs that had the placebo effect. So we thought that it was working, but actually it was proven that there was no difference in their lameness. So that's really powerful example of this caregiver placebo effect. And it's really important that we try to be as kind of objective and subjective as possible, that we really need to be thinking, is this real what I'm seeing, or am I just, am I thinking, oh, there's a slight improvement, when in actual fact there probably isn't. So we really need to try and monitor it very carefully. Now I've kind of released pain monitoring charts and that kind of thing, and there are various different tools when it comes to arthritis, but also when it comes to itchiness or whatever it is. We need to try and make specific observations to say, well, okay, my dog wasn't going up the stairs and now they are going up the stairs. So that would be a clear sign that they are probably feeling better. But if it's a case of, they were walking for a little bit, but maybe they're going a little bit further now, or they're panting slightly less. Now that's, going to be something that will, we can easily misjudge. So that's kind of caregiver placebo. We really need to be careful of that. And like I say, none of the things that I'm talking about is trying to say that you're wrong or putting any blame, but it's just, these are just human nature. And I do these, absolutely. I know, I'm aware I do this, but I always kind of being aware of these phenomenons, it does mean that I've always got in the back of my mind thinking, is this working? Is this actually what I'm seeing? Is my intervention really making a difference? A big thing for vets and a big thing for you if you're giving supplements is, are they getting better in spite of what I'm doing? And that has certainly caused me, and as new evidence gets produced, caused me to actually change how I manage certain conditions, because it's very apparent that even though I thought a specific intervention or treatment was making a difference, actually it wasn't making any difference at all. It wasn't doing any harm, but it wasn't causing any improvement. The improvement we were seeing was because they were going to get better anyway. A clear example of this is cystitis in cats. Now that's not due to an infection, but people will still give antibiotics, even though that's really kind of well proven that in the majority of cases there's no infection. But if you give antibiotics, the cat will get better. But if you don't give antibiotics, they're going to get better in 3 to 5 days anyway. So you can see how it can be quite difficult to make good decisions. So that's caregiver placebo. So the next thing to talk about is something called regression to the mean. And the best way to think about this is just to kind of do a little thought experiment. So if you imagine your pet seems to be a bit painful. Now what's going to happen is you're going to rest them for a few days to see if they get better. If it's not too severe, you're not going to rush them, or you're unlikely to rush them to the vet clinic, or you're unlikely to make any changes. You're going to give them a bit of a rest. As that pain level gets worse, again, if we're an arthritic dog or cat, as that pain level gets worse, you're going to start to think, well, maybe I need to do something. I wonder if there's anything I can give them to make them more comfortable. It's going to get worse again. And when it's about as bad as it's going to get, then you're going to take them to the vet and give them some treatment. Or you're going to jump online. You're going to say, well, I've heard turmeric, for example, is good. So I'm going to add a teaspoon of turmeric to their food a couple times a day and see what happens. The problem here is that with our long-standing diseases especially, is that they really do fluctuate. So the severity of an arthritic dog's pain is going to get worse, and then it's going to get better. Naturally, it's going to reduce, and then it's going to get kind of really quite good. They're going to seem comfortable before slowly getting worse again, and they're going to fluctuate, over time. If you give that intervention when they are at their very worst, then the only thing that's going to happen is they are going to get better anyway. But what it's going to look like is that the intervention that you did, whatever it was, the medication that you gave, maybe the supplement that you gave, the physical manipulation that you did, the massage, the cold pack, whatever it was, the cream that you put on their skin, the shampoo that you used, it's going to look like that made the difference, when in actual fact they were going to improve anyway. The reason it's called regression to the mean is the average level of pain. So if we're only giving an intervention, or the average level of whatever it is that they're suffering from, of itch or whatever, but if you're only giving that intervention when they're above average, then it's always going to look like what you did made a difference. Equally, if you gave something when they were as good as they are ever going to get, so actually they were a lot more comfortable than average, then it would only look like that actually they got worse and the treatment didn't work. So that isn't often what happens, because we don't start things when your dog or your cat is feeling well. We start them when they're feeling at their worst. So it's really, that's another thing to be thinking about, really. And that goes back to, were they going to improve anyway? So this is more of a thing with long-term chronic diseases. So arthritis, again, being the classic one, but anything that your pet is dealing with on a long-term basis. So it could be itchy skin if they've got allergies, then that does tend to fluctuate. We need to be mindful that they may get better anyway, especially if we're only looking at making interventions when they're at their very worst. So that's kind of regression to the mean and caregiver placebo, but there are other things. So when it comes to actually looking up information, looking for evidence, I'm sure you've seen online, if you've jumped into any forums, people will say do your own research, and that's all very well, but if we're doing our own research, we actually need to do it properly. We need to have a system in place, and we need to know what our aims are, and we need to know how to go about researching. So if I have got a pet with arthritis and I want to have a supplement, and I've heard that turmeric is a really good supplement for that. I've read that on a forum somewhere, and I want to research that. Is it a good supplement? And I just type into Google, how does turmeric work in arthritic dogs, for example, or how much turmeric should I give an arthritic dog? The chances are you're only going to come up with results that say turmeric works, this is how much to give, this is the beneficial effect it has. You're not going to see any other results to say there's no evidence that turmeric works. Actually, the curcumin, which is the active ingredient, is in really small quantities, and the likelihood is that the dose that you're giving isn't making any difference at all. Or it might be that you don't notice the fact that it says this can help, but it's going to take 3 months to make an effect, to have an effect. We're kind of looking for data that confirms what it is that we believe. So that's really what cherry picking is. We're taking the information that we want to believe, or that confirms our already held belief, and we're completely disregarding the information that contradicts that. It could be that you type in evidence for curcumin benefit in arthritic dogs, or whatever it is, and you get a whole load of things. But if you believe that turmeric is really good, if you're already going in with that held belief, and you're only looking at information that confirms that, and you're not going onto the websites that say actually there's no benefit for that, or there's no real evidence to support it at this stage, and there may be better treatments that you can give. Again, we're cherry picking the data that says it's working, when in actual fact the bulk of the evidence may say no, it doesn't work, or there are better things, or there's not really any evidence, watch this space, but maybe you should think about giving another treatment. So that's really what cherry picking is, and it's only natural that we want to look for things that agree with our own held beliefs. If you look on Facebook and all that kind of thing, all their algorithms, you'll notice that if you've liked certain topics, they're going to feed back more of that same kind of opinion, and there's nothing quite like politics to really highlight this. But if you believe, if you follow one certain party and you have some strongly held beliefs, you're only going to be shown information that agrees with you, or you're only going to interact with information that agrees with you. And so it's a bit of a self-perpetuating cycle. And so cherry picking is very much the same. So how do we then do research? So you want to try and research both points of view. So you want to say, how does curcumin, how does turmeric help? But you also want to look at, maybe, is turmeric the best treatment for your arthritic pet, or what are the best treatments for arthritis in dogs? And you want to try and get the counterpoint. So you want to really look at the evidence. kind of combined with this, as well as cherry picking, is then the Dunning-Kruger effect. So again, this sounds complicated, but it's really not. The Dunning-Kruger effect is basically a case of people who don't really know very much believing that they know it all. So there's a curve, and I've done lots of pieces on all of these things, and I'll leave links in the description and things down below. Really, there's a common phenomenon that when we don't know anything about a topic, we're quite happy to admit we don't know anything about a topic. The problem comes is when we gain a little bit of information, we actually don't realize how much we don't know. We think we're getting a really good hang on the topic. And so our confidence in explaining that, our confidence in our knowledge is really high. And at that point, we're quite happy to jump into forums to say, this is the truth. This is the facts about the situation, when we only have a really small amount of knowledge. Now, as we gain more knowledge, so our confidence, it really skyrockets, even though we don't know very much. As we start to know more information, we go, hold on a minute, there's an awful lot to this topic. I'm never going to get it. I'm aware there's so much I don't know about this. And your confidence absolutely plummets. So even though you're gaining more information and you're more knowledgeable on that topic, your confidence in your ability or your levels of knowledge are really, really low. You feel like you don't know anything about it. You've only scratched the surface, and you really would be reluctant to give advice. As you then get more information, you slowly start to rise. So you start to think, oh, I'm getting the hang of this. I'm starting to see where this is going, but you're still aware that there's a whole lot you don't know. And when you get to an expert level, when you've been doing something for ages, maybe your 10,000 hours that it takes to, become an expert, or you're getting towards the end of your degree or your PhD, or you've been a professor or whatever it is, you've really experienced in your industry, then, and you know an awful lot, and you actually do know an awful lot, then your levels of confidence in that information that you're delivering starts to really climb and get to a level, or the same level, as someone who really knows only a tiny amount. Now, the problem with this is that at the moment, at kind of this point in time, a lot of expert opinion is disregarded. There's been a real backlash against experts, about people who have been in that field for years and years and years. And we kind of got the kind of court of popular opinion, if you like. But the problem is that a lot of the time on forums, people who are commenting, who are giving their opinion, who are giving advice, are those who actually don't have a huge amount of information, but they're right at that top of that confidence level in that Dunning-Kruger kind of curve, if you like. And that's called that's really the Dunning-Kruger effect in a nutshell. Now, that's not to say that there's anything malicious about these people who are giving advice. They really just don't know what it is that they don't know. So if you think you know everything, if you think you've got a good handle on it and you want to help people, then it's only natural that you give advice. And that's fine. And it's fine to, to look at that advice. But what you really need to be careful when you're doing your research, if you're reading that experts in that field, and this goes for anything in life, it could be financial advice, it could be the plumbing in your house, it could be absolutely anything, how to fix your car, or what could be going on with with whatever. If the information that you're reading about in forums, or the advice that you're being given in forums or in blogs of just random pet owners, for example, in this case, if that contradicts the popular opinion amongst the experts in that field, then it's not because there's a conspiracy. And that's another thing, that's another reason why there's been a big kind of backlash, if you like, against experts, is because there's a belief that there's a conspiracy, that people don't have true motives. Vets, for example, that we only want to keep our patients sick so that we can make more money. Now, if that sounds like your vet, choose a new vet, because if that's what you believe, you're not doing them any favors in going to see them, because we need to have a trusting relationship. Also, it's just not true. Vets get paid off by pet food manufacturers to recommend their diets, even though we know that they're terrible for our pets. That's not true. But if you jump online, you're going to see these things everywhere. And also, the problem is that these people who are kind of suffering from the Dunning-Kruger effect, they really are very quick to criticize. They're very quick to cast aspersions, to effectively slander people who maybe say things that disagree with them. And so a lot of the time, the experts are not engaging in those forums and engaging in those platforms because they can become quite toxic. You feel like you're beating your head against the brick wall. You're getting all kinds of personal attacks, and it's really not worth your own mental health to be engaging in those platforms. So, that's something to really think about strongly when it comes to researching anything that we do to your pet. Now, I'm not saying that you should absolutely just go to one source, believe that one source, and not try and confirm that in other places. I absolutely, definitely think you should. I'd love you to believe everything that I say, but I'd also love you to go and check in other sources to confirm what I'm saying is true. I think that's very important. We shouldn't follow people blindly because it could be that person that we think is doing a really good job actually isn't up to date with the latest thinking. Maybe there have been different developments in whatever field it is. And so I'd love you, absolutely come to Our Pets Health and research whatever it is that you want. But I'm not saying that it should stop there, but you just need to be really mindful where that information is coming from, what the expertise of that are, what the general consensus around a topic is in that profession or whatever, in that field, your plumber, your electrician, your mechanic, your financial, the financial advisors, what the general consensus is, and be taking any other advice from kind of just your general person off the street with no specific training or qualifications in that field. Take that with a pinch of salt if it really contradicts everything else that you're reading. And so that brings me to the final thing that I want to talk about today. So I don't want to go on for too long because I know it's not it's potentially quite a dry topic, but I hope that you're finding it interesting. As always, if you do have any questions down, just leave me a comment, just shout out now, and I'll do my best to answer them, and I'll answer them kind of if you're watching this on replay as well. Also, remember to hit that thumbs up and share it with your friends as well, just to help spread the word about this, because this is a really important topic, but it's not one that people will typically kind of search out and watch because it's not particularly exciting. Hopefully it's interesting, but it is what it is, but it's very, very important. So anecdotes versus other forms of evidence. So the other thing that will often get held up as proof that something works is because someone tells a story about how their pet was suffering from a certain condition. They did something and their pet got better. Or it'll be the other way. It'll be they were, and this is a really common one as well, their pet had a condition or their pet was fine and they got given something. So that could be a worm, a flea, a vaccination, a painkiller if they're feeling a bit painful, and actually something really bad happened. Their pet died. That would be the absolute worst thing, wouldn't it? So that's an anecdote. We can't possibly know what else was going on with that pet. We can't possibly know with that one story alone if that intervention had anything to do with the end result, be it a good end result and their pet got better, or a really bad end result and they became unwell, they developed a lump, they had a seizure, they died, whatever it is. With that one story, we cannot know that was the case. So let's go back to another thought experiment. If we're talking about 10-year-old dogs, for example, and these figures are just made up, but they kind of will help make a point. If you've got a whole group of 100 10-year-old dogs, and if we say that every month 10 of those dogs die just from natural causes because they're old, well, maybe if we say they're 15 years old, but 10 of those dogs, so 10% of those dogs will die every month. If we then give a treatment to a 10-year-old dog, there is a 10% chance that that dog will die within a month of getting that treatment, having that vaccine, having that intervention that had absolutely nothing to do with whatever it was that was given. 10% of those dogs were going to die anyway. But we don't feel like that because we don't know, we don't know that our dog is in that category, and we don't know that our dog or our cat is in small proportion of dogs, well, that big proportion of dogs who were going to die anyway. And so we will blame, and it's only natural, absolutely, it's completely natural to blame whatever intervention that was given with that horrendous outcome. But actually, it was going to happen anyway. And that's the thing with anecdotes. We can't know if that was going to happen anyway. A proportion of dogs will develop seizures naturally. They will have a seizure. Nothing, there was nothing potentially causing that, or there was certainly no intervention that was causing that. They were going to get a certain disease, for example, epilepsy. A young dog, there's a proportion of dogs are going to develop epilepsy. If a dog has their first epileptic seizure after getting a certain treatment, then we will quite naturally blame that treatment, or we will potentially blame that treatment on causing that seizure. We may even blame that then on causing the epilepsy and the subsequent seizures that happen throughout that dog's life. The truth is, though, that dog was going to develop epilepsy anyway. And we can't possibly know that when someone says a story about my dog was given this and developed seizures. And I was told it was epilepsy by my vet, but I don't believe them. I think that they're just covering up because they don't want me to blame this specific intervention. So that's the problem with anecdotes. Now, does that mean that they're completely useless? No, it doesn't. If we get if we get a lot of anecdotes about the same thing, then we have to go, well, actually, is there something in this? And then we need to make, more studies. We need to look at things a lot more closely and really ramp up the investigations into that phenomenon. Now, it might be that it all comes back completely normal and says, well, no, there's actually no evidence. Looking at looking at kind of notes of a whole load of other animals who had this, the level of seizures that are caused after this particular intervention is no more than the level of seizures in the natural dog population, or in a proportion of dogs who never had that intervention. They both have the same incidence of seizures. But it might be that we go, actually, yes, there is a risk of that. That is a side effect to that drug, to that treatment, and we need to be careful. Maybe we need to stop giving it if the incidence is really high, or we need to add it to the data sheet, or we need to not give it to certain dogs who are maybe prone to seizures, for example. So anecdotes aren't completely useless, but we really need to be taking them for what they are. They are stories that we can't possibly know the full details of. It could be that your dog was suffering from kidney disease, for example. Your cat, kidney disease is really common in cats. Your cat was suffering from kidney disease. The problem is we can only pick up the fact that a cat has kidney disease when they're about 60-70% through losing all of their kidney function. So they only have about 40 to 30% of kidney function left. So they're already kind of really significantly through that disease, but we can't possibly know it. And it may be that just naturally things are getting worse and worse, and the point that it tips over and they start showing signs of kidney failure, and we can pick it up on blood tests, happens after a certain intervention. So it's something that they were suffering from for a long time, but we're incorrectly attributing that deterioration to something that we did. It's only natural, but we need to take it for what it is. Now, this is where other evidence comes in. Now, there's all kinds of different evidence that we can look for that's then better than anecdotes. So we can look at clinical notes, for example, in the vet hospital for all patients presented with a certain problem, or all patients who have been given a certain treatment. Another thing that we can do, and maybe the best thing, well, not maybe, the best thing that we can do is we can do something called double-blind placebo-controlled trials, which, is maybe a topic for another day. But basically what happens here is that neither the vet nor the owner knows whether they are getting the true treatment or whether they're getting the placebo. And we've already spoken about how, we can't really see the placebo, or the pets don't experience the placebo effect themselves. My boxer dog passed away. Hi, Maddie. Sorry. Let's just. How do I get that back? Live message. Let's just. Oh, there we go. My boxer dog passed away last Thursday after his first seizure 6 weeks ago. I'm really sorry about that. And yeah, the example that I was giving was just just an example. He was 8 years old. He had a seizure and was very high dose of phenobarbital to stop the seizures, as he was having a cluster seizures. Unfortunately, he had a stroke. 2 days later, I'm really sorry to hear that. Seizures is a really terrible thing to to witness. I know, and cluster seizures, they're really difficult to control. So yeah, there's a whole load of different things that can cause seizures. If you're interested, I have done lots of videos about that. That may just help explain it if you haven't had answers. It may be that you know what caused those seizures. Yeah, epilepsy is just one of those. So yeah, really sorry to hear about that, Maddie. But yeah, if we come back to the double-blind placebo-controlled trial, so what happens here is the vet and the owner don't know whether they're giving the actual drug or the placebo drug. So that's the kind of the double-blind bit, and the placebo bit is that it's compared. So the actual drug is compared to a placebo, so a sugar pill or a flour pill or whatever it is that's going to make no difference at all. And then the results of any improvement or side effects are compared against each other, because clearly and we'll use a slightly different example here. If a dog vomits after, if 50 dogs vomit in the week after getting the real treatment, but only 5 dogs vomit after getting the placebo, we're going to say, well, actually, that treatment causes, has a potential to cause vomiting in dogs. Now, whether that's significant or not depends on how many, what proportion of dogs develop that vomiting. But if you get 5 dogs who vomit after the placebo and 5 dogs who vomit after the actual drug, then you know that actually they were going to vomit anyway and the drug isn't causing that. So that's really where that other evidence comes in. And the bottom line is that if there is other evidence other than anecdote out there, then the chances are, and there's all things about study design and whether it was done appropriately, but generally other evidence is stronger and carries much more weight than the anecdotes that other people will report. But it's only natural. Like I say, I'm not blaming people for making that link. It's absolutely understandable. But we also need to bear in mind that those extreme results, those extreme anecdotes, they're the ones that we hear about as well. So how often do you put a review online if if you had a good experience, compared to how often do you put a review online if your experience of something was terrible? You're much more likely to complain about something if it was terrible than to say that you had a good experience if it was positive. So we need to also take that into account as well. So anyway, that's it from me really with kind of how to make good decisions. Now, clearly there's a lot more to this, about different study design and all that kind of thing. But thinking about those 5 points is really fundamental and should stand you in very good stead for making good decisions, for understanding kind of how you can tell whether an intervention that you're giving is actually making a difference to your pet's condition, and also how to go about researching a condition effectively so that you can make the best decisions about whether you want to start something, whether a drug's worthwhile trying, whether a specific intervention, supplement, diet change is worth giving. So let me know your thoughts in the comments down below. Let me know what your key takeaway was as well. Was there something here that you really weren't aware of before that maybe you recognize that you've been fooled by, if you like? I know I have. Like I say, I've kind of changed my treatment strategies for a number of different conditions over my career, and I'd encourage you to do the same. So we shouldn't think of the fact that changing our decision is a sign of weakness. Absolutely not. I'd actually argue that clinging on to our opinion despite strong evidence that says that it's wrong is actually a sign of weakness, because we should absolutely accept that we are only human. We're going to be wrong from time to time, and also our knowledge does change